It's hard to do those because it's potentially unethical. I'm sure you've heard sitting as new smoking. That's gained some popularity, which I think for good reason. I would agree. In my opinion, it's malpractice.
Interesting. You would even put it in that category, huh?
I would go that far to say it's borderline malpractice.
What's a ridiculous excuse that you heard people say why they can't move well anymore?
Oh man, a lot of times I'm just getting old. You know, everyone has that excuse. We're all aging literally every day. But I found some very high level active individuals who are in their older ages doing really well. And what's common is they're always moving a lot and they're eating really well. So I don't really care for that excuse. I think people use it a lot. We are aging every day, but it's really how we take care of ourselves. So a lot of people want to blame their age for how poorly they've taken care of their body for the last decade or whatever it is.
Can you give me an example of someone who's in their older age and they're moving really well?
Yeah, several of my clients, 70s to 90s, but I'd say one that stands out is a good friend of mine's dad. He comes up to Winter Park. We ski together all the time. We're hitting double blacks and all that. And he's 60.
Double blacks?
Yep. So he's 68. We hike 14ers together, but he's always stayed active. He was a cycler. He plays intramural soccer leagues in his 50s, He just stays active and he takes care of his body.
Do you know when he started? Or has he been like that
I've
all
known
his
him
life?
since he was, 30, 35, and he was a cycler and he played soccer then. So just a lot of cardio, trying to convince him to get some more weight training in these days. But yeah, he's always been pretty active.
So if someone is always injured, right, is the problem really their body or is it something else?
Yeah, so it could be their body, right? There could be some autoimmune disorders, maybe some hypermobility or EDS on board. But if someone's frequently getting injured or getting hurt or feeling pain, things like that, more often than not, it's people that don't have all the basics dialed in, right? So they're not sleeping 7 to 9 hours a night. They're not drinking half their body weight in fluid ounces of water. They're not eating a gram per pound of body weight of protein, eating fruits and veggies. So they're not really taking care of the nutrition side and the recovery side. That's what I see clinically in my experience is those people who are typically have a lot of chronic pain or have frequent injuries. They might be trying to work out or stay active, but they're not doing the basics at home.
Can we talk more about those basics? Let's make a list so that,
Sure.
people, and let's make it more of a action oriented as well, so that people can execute them immediately.
Yeah.
So how about let's start with, the first one that comes to mind.
Yeah, it comes to mind is sleep, 7 to 9 hours a night. There's a lot of different sleep hygiene tips, keeping the room colder, keeping the room just for sex and sleep, limiting screen time before bed. We're all pretty bad about that one. A lot of people want to scroll in bed and then think they're going to pass out. So I believe recommendation is 2 hours prior, no backlight, blue light, things like that. So just getting rid of the screens or TVs prior to bed. It's going to be super helpful. Outside of sleep, nutritionally, getting at least 5 servings of fruits and veggies per day to get enough fiber and enough variety in the gut to help the microbiome. 1 gram per pound of body weight of protein is a general recommendation. You could argue 0.8 to 1.2, so we keep it simple with 1 gram. And I think it's important to point out that used to be kilogram. So we've went from kilogram to pound, so it's a significant jump in protein recommendations, but that's current. So nutritionally, we talked about protein, fruits and veggies, water intake. So general recommendation is going to be half your body weight in fluid ounces. So I don't see athletes having that same problem, but a lot of people in general, especially those desk workers, aren't drinking much water at all, if any. They might just drink coffee in the morning, maybe a soda at lunch, beer for dinner, right? Like we're not drinking nearly enough water.
Is it really necessary to drink a gallon?
I don't think so. I think that's overkill for a lot of people. And that depends on your activity level. If you're working out several hours per day, you're sweating and you're losing a lot, it's important to replenish those fluids, but also replenish electrolytes. So for athletes, I'm not having them chugging gallons of water. I'm having them supplement with electrolytes.
Mm-hmm. Yeah, because I know there are a few times where I'd be drinking a gallon because I keep drinking coffee.
Yeah.
And then next thing I know, I get a headache, and I didn't know that I flushed all my electrolytes. So I'm here chugging electrolytes at the gym. Yeah. So what else?
Oh, for the stuff basics. At home, the basics.
Yeah.
We talked about sleep, protein, enough fiber, water. Excellent. Stress management is huge, right? We live in like a high stress environment. Everything's, ramping up the nervous system. A lot of lifestyle factors included in that, but stress management is huge.
Can exercise be stressful?
Yeah, it can certainly tax the nervous system and be stressful in the moment. The literature supports that after workout is always going to be lower levels of cortisol and other stress hormones. So although you can increase that cortisol level while you're working out, the benefits of it are paid after the workout.
Would you say that if you're already taxed at work, family, and life in general, and you come and do, let's say, do a CrossFit workout or a super, super intense weightlifting session, is it better to just say, go to sleep instead of working out?
Good question. I would always say it's important to work out. So I would always, in my experience, it's always felt better after a workout. Not many people regret a workout, right? You always generally feel better. Lots of hormones are released there. But I think those are different stressors. I think the lifestyle, the kiddos, the work stressors, that's a little more mental and cognitive stressors, whereas this is, in this environment, it's going to be more physical stress. Most people at work, depending on their career, if they're working at a desk, they're not being stressed physically, right? And so I think we need that systemic stress physically to get those benefits. So yeah, I would always argue if you're going to work out or not, choose the workout. But if we're working out close to sleep, try to be at least 2 hours from that.
So that being said, we can put exercise in that basic category.
Yeah. 100%. I think a basic number is meeting physical activity guidelines. 150 minutes, moderate to vigorous activity, or 75 plus of vigorous. It's not that much to hit. Right. Those are physical activity guidelines put out by CDC years ago. It was World Health Organization, I believe in 24, put out that only 1 in 3 adults are hitting that. And then 80% of adolescents are not hitting that.
Oh,
so
wow.
It's huge.
Yeah.
It's a huge problem right now.
Yeah, because we come to a CrossFit gym and it's a bubble, right?
Yeah.
For us, we see everyone working out all the time, and we think, if you're not careful, you'll think this is the norm, but it really isn't.
Yeah.
So one of the things that is mind-boggling to me is that there's a statistic somewhere there. Don't quote me on this, but I think they said like the average American man can't do like 10 consecutive push-ups. And
wild.
That's wild to me. That's super sad.
Not good. Imagine falling. Can you get off the floor? Can't do a push-up. Probably not getting off the floor.
Yeah.
Sheesh. It's going to make it that much harder. Right.
Yeah.
So.
Okay. You want to talk about myths?
Yeah, let's do it.
Let's do it. All right. So what are some myths that you've heard about PT that, you'd like to debunk?
A lot come to mind. Some simple ones that check off the top are going to be more like legislation and legalities. So for physical therapy in Colorado, you don't need a referral from your physician. We have direct access, meaning if you hurt your shoulder, you can just come see me. There's a lot of benefits to that, and we're well trained to rule out other issues that aren't musculoskeletal in nature. We can also order imaging, so that's super helpful if we need that. Because the traditional model, if you get hurt, and you may have experienced this, let's say you tweak your shoulder, tweak your back, you're going to try to go see doc just to get an order. Doc is probably going to give you maybe a muscle relaxer, some kind of pharmaceutical, because it's pretty simple for him to write a script, him or her. Maybe some imaging, some x-rays, and then they're going to send you to PT. What if we could just go see PT that day or the next day? Way more effective. And I'd argue we're saving a lot of time and a lot of money in that regard. So not having a referral, most people think you do. That's state dependent. So every state's going to be a little bit different. Another myth, this is in the PT realm. I feel like I get this a lot. Patients or clients want imaging. They're like, well, wait till we get an MRI so we know what's going on. Let's go get an x-ray so we know what's going on. How do you know what's going on? We're trained on a lot of different clinical examinations, clinical tests and measures that we do to help us figure out what's going on. And the harmful part about imaging is if it's not a significant fracture or ruling out some kind of tumor or anything like that that's more serious, imaging is usually going to show something, but it's whether that is correlated to your symptoms or not. So an example, there's some crazy stats on this, but then the numbers are going to range based on age, of course, but let's say they did thousands of MRIs and looked back at it. So people who had no back pain, they did MRIs. Out of everyone with no back pain, by the age 50, 80% are going to show degenerative disc changes. At age 50, I think it was 30 or 40% are going to show a disc herniation or a disc bulge. And so those are people with no back pain. So that just tells us imaging does not explain our pain. And it's multifactorial. There's a lot of issues that can go into those pain experiences, and related to stuff we hit on earlier, the nutrition, the lifestyle, the stressors, the sleep, the alcohol use, the trauma. Maybe people had trauma in their childhood, and that's leading into their pain now. Body Keeps the Score. It's a great book, but the body does keep the score. So I think that's another myth. People think they need imaging to know what's going on, right? But educated and experienced clinicians can typically find that out. And to be honest, we don't always need to know. We don't need to know, is it supraspinatus? Is it infraspinatus? Whatever it is, most people need to get some movement going and need to have some guidance on some safe movements that feel good for them and things that they can load up and rebuild capacity in those tissues. More myths?
More myths.
Let's hit a couple more. One of them I get a lot is about having surgery, like we need surgery, or that maybe surgery is more effective than physical therapy. That really comes down to what the issue is. Certainly, if you cracked your femur in half, we should get that repaired surgically. We should put some plates and screws and things to get it all back together. But generally speaking, I'll reference another book by an orthopedic surgeon. It's called Surgery, the Ultimate Placebo. It's a great book. It just chats about all the factors that go into surgical outcomes. And they've done a lot of placebo studies. However, it's hard to do those because it's potentially unethical, right? We're telling people that we're getting their meniscus repaired, but we're not repairing it. We're going in arthroscopically, cutting in the skin, but we're not repairing the meniscus. But what's interesting is the outcomes are essentially the same. So there's a lot of surgeries that aren't actually better than just physical therapy alone. And the top ones that come to mind are going to be meniscal repair in the knee, rotator cuff repair in the shoulder. Those are top two, and you could argue certainly some lumbar spine surgeries as well.
Why are they saying get a surgery when they know that's the result?
Good question. There's a lot of money to be made.
A lot of money?
A lot of money to be made.
That's wild.
Yeah. I mean, we could dive real deep on that. Unfortunately, I've experienced quite a bit of that in the medical system, and there is quite a bit of corruption up top, right? A lot of people are making money from pharmaceuticals. A lot of people are making money from surgeries. I'm not saying surgery is not effective. I'm not saying surgery is not indicated at times, but it's heavily overused, just like pharmaceuticals. There's a study recently about 70 to 90% of people with disc herniations heal without surgery.
Oh, wow.
Yeah. So we know now we need mechanical pumping of fluid around the disc, since there's not direct blood supply to the disc, but we need more movement. We need safe movement. We need proper exercise prescription, things like that. But just going in there and shaving a piece of the disc isn't always the answer. And 70-90% could heal without surgery.
Yeah, let's go ahead and talk about your background.
With my experience?
Yeah.
Yeah, so basically growing up, I remember having some amount of low back pain. I was maybe elementary school, middle school aged, and I went to a doc, and they basically had me lay on my stomach and raise my arms out like a Superman move and just hold it. And I held it for over a minute, and he's like, yeah, you're good. So that was kind of their testing. He's like, I think you're good. I think it's your backpack, right? So we adjusted backpacks, we held it a little bit higher, things like that. I managed. It wasn't a big deal. It wasn't until college where I was playing intramural softball. May have been a certain rotational movement or something that was kind of the last straw, but I remember waking up, couldn't get out of bed, severe back pain. Thankfully, nothing down my legs. It was all localized to my spine, no radicular symptoms or sciatica or anything like that. But that was when I really got to experience what most people experience with acute low back pain. Acute meaning it just happened, right? There's an injury, there's a specific mechanism, so it was acute. So I went in, didn't have health insurance, right? I'm a college student. I went into the on-campus medical facility. It was a older, overweight nurse or nurse practitioner who I saw, and She told me, I explained the situation, my symptoms. It was a pretty quick exam, like most people will experience, maybe 5 minutes or so. She prescribed me muscle relaxers. She ordered an x-ray, which showed a little bit of scoliosis, which wasn't relevant, right? But we picked up a finding. It wasn't relevant at the time. And she told me not to lift more than 5 pounds. So I was lifting every day, 5 to 7 days a week, on campus gym. I was playing intramurals, flag, basketball, softball. We're benching 250 plus pounds, squatting more. Like 5 pounds is a gallon of milk. The most frustrating part was she said I shouldn't lift more than 5 pounds. She gave me a printout of some outdated exercises, something to do with stretching my hip and stretching my low back, which is another topic we could chat about, stretching. But the 5 pound limit, the hardest part about that, and I see this time and time again, there's no deadline on that. We never talked about how long should that 5 pound restriction be. Now, if she was to say, don't deadlift 250 today, that's a different and more acceptable accommodation. But for her to say, don't lift more than 5 pounds and leave it at that, that's harmful. That's harmful because then it gets in my head, gets in people's heads like, I can't lift. I'm fragile. I'm going to rupture something. Spine's just going to blow up. People have these thoughts. But yeah, then I got an MRI, and then that was devastating because they found 3 bulges, and then that got in my head, right? I stopped lifting. I stopped playing those rotational sports. I was nervous. Over this time, this is a couple months that went by, things got better, right? Naturally. But I got to a point where I was numbing it. I was drinking a lot of alcohol. I was a server at the time, carrying a lot of heavy trays, ice buckets, syrup boxes, etc. I would just numb it, just drink, go to work, serve tables. It was a bad time of that phase of life, dealing with back pain. And it honestly wasn't until a really good physical therapist named Randy Spence down in Texas. I was working with her as a PT technician, trying to get into school. She was like, I think you just need to get back to it. I think you need to like mentally get back. Let's play some sand volleyball. Let's heavy lifting again. In the moment, I was a little frustrated. I was like, she doesn't know. She doesn't know how bad this sucks. Like, she doesn't know what I'm going through. Turns out she did. She's experienced it. She's dealt with thousands of people who experienced it. And her advice was the best advice because as soon as I started lifting again, essentially it was gone. I mean, it took a little bit, a couple months. But yeah, now I manage it with weightlifting. I've been, I joined y'all's gym. So I get a lot of load there, a lot of volume. And that's the best thing for my spine. It's the best I've ever felt is staying active in the gym and working out.
When they say with bulging, right?
Mm-hmm.
Was the default recommendation surgery back then?
Good question. Back then, I don't think we talked surgery. I think we got the MRI and then we talked injection. Got the injection, but I was nowhere to have surgery. I was a college student, didn't have insurance, just wasn't an option. Mentally, I was super scary, right? Someone cutting next to my spinal cord. Don't want to do that. So yeah, it wasn't ever an option on the table.
Mm-hmm. So moral of the story, lift weights.
Generally speaking, a lot of problems would be solved if people just moved more and lifted more weight. Yeah, 100%.
There's a few doctors now. Actually, there was one doctor that I forgot her name. I wish I knew her name, but I wish I remember. But she's telling women now to lift weights, and even guys tend to lift weight to begin with. But when you're in your 20s and your 30s, you have to build up that muscle because it's going to be your body armor when you're 60 and 70. I mean, yeah, there's like some studies that say that the stronger your grip, the longer you're going to live, but that's just a proxy for actual strength, right?
Yeah.
So build as much muscle as possible.
Yeah, there's correlation with grip strength with longevity and lifespan. Recently, they came out a study with quad strength, so knee extension, strength correlating to lifespan and longevity. What do those two have in common?
Strength.
So generally strength. What is it? I think it's after the age of 30, each decade of life, we lose 10% of strength in general. So like 20 to 30 is that crucial range to boost testosterone, to boost muscle mass, to boost bone mineral density, to set yourself up for success later in life.
What do you think though of people who say that when they're already 40, that's it? That's quote
Like it's too
unquote
late?
old. Yeah, it's too late.
Well, I would refer back to that stat. In 10 years, we're 10% weaker. How can we mitigate some of those risks in that strength training?
Yeah.
Functionally, it's always going to be helpful and later in life. How do we get up and down from a chair? We squat, How do we carry our groceries? We do carries, How do we get off the floor? We pull up from something, or we stand up in a lunge. So it's super functional. But yeah, I would argue it's never too late. There's some good physios out there through ICE, Institute of Clinical Excellence, really pushing and advocating for older people to also work out. They're saying is old, not weak. Great education from those people. Dr. Dustin Jones, I believe it is a big leader in that space. So check him out. But yeah, it's never too late.
Never too late. Yeah, CrossFit, even with CrossFit, they have a course dedicated to coaching the aging athlete.
Nice.
And when I read the book, this was a long time ago though. So they were saying that even guys or everyone in their 40s and 50s, they're still hitting PRs, and it's wild how your body can still improve, or at the very least mitigate some of those bad stuff that might happen down the road.
For sure. So, yeah, our bodies are great at adapting. I think it's really what it comes down to. We adapt to our environments. We adapt to the stressors and the loads that we put through our body and tissues. I think generally, when we think about lifespan, we go through phase of being more active as a kiddo. We got school with recess. We got sport participation, things like that. We get in our 20s and 30s, start getting in our career. We stop playing sports as much. We might stop working out as much because we have more time constraints. We might be working 40 hours a week or more. We're commuting. That's even more time of the day. So we have less chances potentially, but I don't think it's that we're aging. There are some physiological changes as we age and hormonal changes as we age, but it's less about aging. It's more about what are we doing? We're moving less. We're sitting more. We're going to sit in our car to drive to work, to sit for 8 hours, to sit in our car to drive home, to sit at dinner, then sit on the couch and watch Netflix. Like, what are we doing?
Yeah.
And then we just think we're old. It's like, oh, I'm just 50. I'm just getting old. I'm like, no, you haven't done shit in a long time.
With that being said, let's talk about some of the daily habits that people have that it's just ruining their movement ability. And then you mentioned sitting.
Sitting's huge. I'm sure you've heard sitting is the new smoking. That's gained some popularity, which I think for good reason. That example of sitting all day as we sit now, right? Sitting all day, drive to work, sit for work, drive home, sit for dinner, etc. We are adapting to that. Our body's adapting to that. Our hip flexors get tight. Our pecs get tight. Hamstrings get tight, things like that. And then things get harder because we're not adapting to a strength stimulus. We're adapting to sitting more, and we're getting super comfortable in that.
Yeah. When I got my job, before I have my job right now, because it's a desk job, I was working with USA Swimming, and about 60-70% of it is shooting videos. And then you go back to the office, you edit, and then you go back and shoot. You travel, you go shoot. It's a lot of movement. And then when I got this job, I was like, that's when I started getting some back pain, and I thought it was just like bulging disc and stuff like that. And then I got an X-ray, and then they said my hips are tilted. I was like, oh, your one of your glute atrophied, and I was like, oh, it's my desk job, like just sitting like 8 hours a day. So now I got a standing desk, and now I'm like building up the strength thing in the back. So yeah.
And what did that do for you? Did that make a change?
It made a change. Yeah. Okay. I can. It used to be I couldn't even pick up 135.
Wow.
And now it's like, during the open, I cleaned I clean and jerk 275.
Wow.
So yeah, it's
huge.
the strength, kind of like what you said too, because in my case, I was scared to use it. I was really scared, and it got worse and worse and worse. And then doing research and doing I talked to like a PT over at a physical personal trainer though. He's a personal trainer, but he gave me some exercises and that helped me. I was like, okay, I'm in the right track. So.
Yeah.
What else do you have, like some bad habits that people that's like ruining people's movement ability?
I think this could be harder to conceptualize as a movement ability, but the nutrition. I didn't know how bad junk food made me feel until I stopped eating junk food. Now, if I eat one thing that's processed or junk or fast food or whatever, tears me up. but we're good at adapting, right? So if you eat junk food every day, you may not feel it, but it's tearing you up and it's hurting your cells. At a cellular level, it's destroying everything inside our body. I feel, long term. So the nutrition part, sitting too much and eating like shit.
Yeah.
Those are the top two that come to mind. And that's generally low hanging fruit. Go for a walk, at least one a day. Like they've even brought down the step count down to 7,000 instead of 10. Super attainable goal. Assuming you're able-bodied, right?
How many minutes is that? How many minutes is 7,000 steps?
Good question. Under an hour.
Under an hour.
Yeah, you can break it up.
That's not a lot.
No.
What else? You got any more?
Things that come to mind that are hurting people's movement ability.
How about
I think the lack of mobility, but that refers back to that sitting. Like we're just not moving our joints through full range of motion. So not doing any type of like mobility training. I'm not saying you have to stretch, but any kind of mobility or yoga, Pilates, things like that are great adjuncts.
You mentioned something about stretching earlier. Let's talk about stretching.
Okay.
For a workout, is it really going to prevent injury? Stretching?
No.
Explain.
Yeah, Short answer is no. There are different types of stretching, static versus dynamic. So static is like we're going to stretch our hamstring for a minute. You see that at every 5K. Somebody wants to lean over and touch their toes for a minute, and then they're off to the races. Studies time and time again show that static stretching before activity decreases performance and power output. So a dynamic stretch, something where, let's say, for example, instead of a hamstring, touch your toes, we're doing long leg kicks, soldier walks, whatever you want to call it. Something that's quick, you get a quick stretch to the nervous system, you get a little bit of blood flow down. That's much more helpful than static stretching. So in a general sense, you're going to do dynamic stretching prior to activity or workout. Static stretching can be nice for after to try to gain range of motion.
In what way does the static stretching degrade performance? Is it because the muscles get stretched too much that it won't go
harder time to contract?
Yeah, it won't contract as fast.
Won't contract as fast.
Yeah.
Yeah, that's the thought there. So we're like stretching out more sacromeres. We're not getting that tight, quick contraction.
In terms of injury, people still can get injured.
100%. Yeah, I think what prevents more injury is loading tissue. So we have our tissues have a capacity just like anything else, bones, ligaments, tendons, muscles, etc. Through strength training and exercising, our goal is to raise tissue capacity so injury rate is harder to get to. If we keep capacity low, we're going to exceed that likely through a high intensity workout, going for a quick jog when it's been a month since you've done it. That's where we get those injuries and those flare-ups, the tendinopathies and acute tendinitis and things like that.
So for a runner who gets injured all the time, let's say an ultra runner, or I've heard of some triathletes like getting injured all the time, would it be valid to say that strength training would make them more durable then?
100%. Those folks, how do I say, are usually a little different breed, the ultra runners and the triathletes, but in general, yeah, the ones who are successful and the ones who are staying out of PT offices and orthopedic offices are strength training regularly, 2 to 3 times a week minimum. And it's not until they do that, they won't see their performance take off. They'll see the recovery take off. They'll hit PRs. But yeah, it all kind of comes back to that strength piece.
Yeah, you said like all roads lead to load.
Yeah, it's a nice quote from many faculty, but mostly Dr. Jeff Moore at ICE Physio, ICE Institute of Clinical Excellence. All roads lead to load. So they do a lot of continuing education for physical therapists. I'm currently on their orthopedic certification track, and then I'm taking their fitness athlete certification track as well next year. But they preach on that. That's big for them. And they're, again, back to the whole tissue capacity. We're trying to raise tissue capacity so that injury rates and exceeding capacity is harder to do. Does that make sense? Like on a graph, raising tissue capacity, make it harder to reach your limit. But they're big on skilled manual therapy. We're doing dry needling, we're manipulating, et cetera, whatever we need to do. Patient education to inform them on what this is, what it looks like, how you can recover from it, and then loading people. So no matter what it is, we're loading some kind of tissue.
So I'm guessing though, like if they're, let's say, injured in some way, like you, because that's the scary thing about like for me as a CrossFitter too, right? When someone's injured here and like, I don't want to, it's not like I'm bragging, but like I've had athletes who think like I'm a doctor or something.
Mhm.
Like, they'll ask questions about stuff that they should be asking their doctor. So it's
Yeah.
like kind of scary for me to ask to answer those questions, or if there'd be nagging shoulder. I was like, I'm not really comfortable telling them to do an exercise that I saw online on
Yeah.
YouTube. So I was like, all right, I'll just say go to a PT, or just like you. Like, what do you tell someone like that? Like, so when customers, let's say clients, go to them and say, hey, my shoulder's hurting, what should I do?
So are you asking for my approach, like if we're in the gym setting and they ask a quick question, or if I'm like evaluating in the clinic?
Like a gym setting.
So gym setting can be tough, right? So I'm trying to give them some quick advice just to calm things down. My general advice is we can almost always find a modification. So if it's a shoulder thing and we're doing a lot of snatches that day, can we modify that to a dumbbell instead of a barbell? Can we lighten the load? Worst case scenario, we're going to do something different, something accessory, but we still want to pump blood around that area. So if a snatch is super uncomfortable, maybe we're going to just swap them out for a bent over row that day. Maybe we're going to do a one arm press, keep it close to bicep to the ear kind of thing, instead of more abducted out here. Finding something that's a little bit more comfortable and let them run with that is largely beneficial, because we're getting that systemic blood flow pumped to the area and to the rest of the body. So I think we miss out on a lot of opportunities if we just tell them to rest it or like skip the day. I think that's some of the worst advice we could give them. We still want to keep them in the gym. We can always modify. And you guys are great as coaches at modifying stuff. Let's find something that you can do. We're going to hit that hard today.
Yeah.
Worst case, we get on the bike, right? Something. Blood flow.
Yeah, that's usually a scale. We say it's one of the go-to words that CrossFitters use. Scale.
Yeah.
Because you can always scale up, you can always scale down. It's what we're trained to do as well at CrossFit level 1 and 2. That being said, though, now that you're a CrossFitter, share your experience. How did you get to this point? How did you become a CrossFitter? What were your do you have any second thoughts about doing it? What were the things that you've heard about it? And let's go.
Yeah, so I was always told it's kind of the cult, you're just gonna tear up your body. It's so bad for you. It's gonna jack up your shoulders. You're gonna hurt your back. It's too much volume, et cetera, et cetera. Even back to PT school, I had colleagues who kind of put it down or thought it wasn't beneficial. Within a month of getting in here, I love it. I mean, I think it's the intensity that I was missing. I lifted weights in my garage gym, but I'm not pushing myself the way coach pushes me. I don't have that supervision. You guys are so good about going through the fundamentals, movement preps, walking around the room, making sure everyone's dialed in on technique. I think CrossFit gyms that may be overlooking that, probably going to have some more injury rates and higher risks and things like that. But from my experience at Endemic and working with you guys, it's been wonderful. But yeah, I love the intensity. I'm going to sign up for a competition in April. The True Challenge, I believe.
I don't know. I've heard of it.
It was like an entry level, scaled CrossFit event. I'm going to check it out, but
it's probably the Festivus. I think they rebranded Festivus.
Yeah, it's that one. So I'm
That's my favorite competition.
Oh, really?
Yeah, I did. My first year, my first 2 or 3 years, I kept doing it. Yeah,
nice.
Yeah.
So I'm going to hit that in April. But yeah, it's been great. I think the overall intensity is a really nice piece that a lot of people are missing. The full body movements, like we're not doing leg day or like arm day, right? We're hitting almost full body movements every single time to different degrees and different volumes. But it's been great for that. I think the community environment is underrated, and I think that's a huge piece. Like to get in here with other people working hard and pushing each other and just being motivated is huge, and it's so good for people. Our socialization has come down, our physical activity has come down over the year, especially with COVID. So to be in an environment where it's a group setting, I think is huge for people, and I really enjoyed it. So,
do you have CrossFit clients? What's the most common injuries that you see that they have?
Yeah, I see quite a few CrossFitters now, and I've been working with Pinnacle Weightlifting for a couple of years. So I see those Olympic weightlifters. Both of them, most common is definitely shoulder. Definitely shoulder. I would probably go hip or back for number 2. Maybe hip then back, surprisingly, a little more hip stuff. But what I find out, and this is why I think it's huge to see a professional, is most people have some deficit that they're training through, and it's just a matter of time. It's a matter of volume and a matter of time that until they're going to feel it. And if they don't address it, we're likely just getting worse and using some compensatory strategy. An example I can think of, I got a 48-year-old lifter. He's been a CrossFitter his whole life, owned a gym here in the Springs. Now he's a competitive weightlifter last couple years, Masters division. Started having some shoulder and neck pain with overhead days, a lot more snatches and stuff like that. Come to find out, significant lower trap weakness on one side, some instability overhead. So his glenohumeral joint is less stable overhead from less efficiency in the rotator cuff and other stabilizers. So dialing that in, just giving him a few drills to do, priming himself before overhead days, neck pain's already resolved. Now we're dialing in the shoulder. So I think a lot of times people just have these underlying impairments that maybe are missed or not addressed through their own gym or whatever the case may be. I think it's important that you guys do the fundamental one-on-one so you can kind of dial some of that in, because in a group setting, it could be hard as a coach to see 15 people and point out those subtle differences. But yeah, with those overhead lifts, the CrossFitters and the weightlifters, more shoulder stuff.
Mm-hmm. What do you think causes, let's say for a snatch or a jerk, is the internal rotation? Is it more of an internal rotation problem or external rotation that causes
Of the shoulder?
Of the shoulder. Or does it depend to, because I've heard all kinds of arguments for it.
Yeah, man, there's a lot of stuff online for sure. You could YouTube anything and get some misinformation. That's why I always say see a professional in person. One thought is you can come to my shoulder workshop February 20th, 5:15 here at Endemic.
Yeah.
And we'll really hone in on stability versus mobility. We need a little bit of both. But as far as internal or external, if I had to choose one, you're talking about snatch specifically? More external.
External.
Yeah. And that could go 2 different ways. Are they limited in external rotation where they can't get all the way in that position? Or do they have weakness in external rotation that doesn't provide that stability up top whenever they're in that position?
Yeah, because CrossFit teaches the external rotation, weightlifters teaches the internal rotation, and then they both have arguments for both. So
is the argument to improve one and it'll make it better? Or what's
the argument that I heard from a red shirt who said that do external rotation is because it's safer. The argument that I heard but from weightlifters is that you can really lock it up, and then you can lock it up so that you can just keep pushing it. You can keep pushing the weight up. So that's
okay. So I don't know if I understood the question. More of like strength in ER versus IR.
Yeah. Or what keeps you safer too. So
yeah, I think it depends on the movement. Certainly getting more internal rotation is going to help lock up, especially in the bottom position, and going to engage lats more because lats are internal rotator. I was picturing external rotation mobility getting into that position. So I could see both.
Yeah,
both are important.
Yeah.
I usually look at what we call arc of motion. You'll notice with baseball players and stuff, you want at least 180 of a full arc. A lot of pitchers will have a ton of external rotation, maybe 120 degrees instead of 90. But do they have at least 60 of internal? So we're looking at the full arc. They may need a ton of external rotation for that pitch. But we just want to make sure that the combination of internal and external is getting to at least 180.
Yeah.
So it kind of depends on the sport and the movements.
Right. Yeah. Yeah. In terms of the snatch, I've heard of another one is it depends on your rib cage. So I forgot. I don't know. I read all.
There's a lot on YouTube.
Yeah, I know. There's a lot on YouTube. So, but anyway, that's why I'm here talking to a professional.
Yeah, I think it's always important. And to see a professional, see someone in person, see someone who's qualified, see someone who works with that population. If you're a CrossFitter, you should be going to a physical therapist who either does CrossFit, coaches CrossFit, or sees CrossFitters on a regular basis. They know the movements, they know the demands, they know the volumes, they know the training schedules. That's different than the typical run-of-the-mill PT who might be seeing 4 people in 1 hour, right? It's just me a lot different time, quality, attention to detail. If you're a swimmer, ideally you're seeing someone who sees a lot of swimmers, or maybe they were a collegiate swimmer in the past. They can understand and relate to you a lot better. Something that I challenge my clients with a lot is they'll come to me with questions, or they'll come to me with things that they've done and things that they've tried. And sometimes the feedback is, if you could do this on your own, you wouldn't be here right now. Right? And most people want to do it on their own, and that's fine. Most people want to go to Google first, maybe some YouTube search. Maybe we're looking at Squat University or Bob and Brad or something crazy online, but then it may work a little. It may not really get you to where you need to be, because it's usually something that's a little bit more individualized. It's hard for someone over YouTube to do that, to relate to you the same way as you can in person doing a full evaluation. So I just kind of bring it up. You wouldn't be seeking professional advice if you could have done it on your own. You would have done it by now. Or people who want to lose weight, they think they have all the tools. The knowledge is there. We have tons of knowledge online, but if you could do it on your own, you would have lost weight already. So it's really important for those people who can't do it on their own to seek professional help and get that one-on-one care.
Yeah, in terms of PT too, because like I was one of those guys, right? So Google the whole thing, Chat GPT,
Sure.
get the program. 3 months later, I mean, you'll feel a little bit okay,
Yeah.
but you go back to baseline after that. I was like, I wasted 3 months.
Yeah. Right. I mean, I think that's the biggest piece is the efficiency. That's like hiring a strength coach. You can get stronger on your own. Hiring a strength coach, you're going to get stronger faster, no doubt. If they're programming effectively, if they're talking about nutrition, it's just a quicker route. So like, how much time do you want to spend? A lot of times it's a financial barrier. I don't want to drop the money. I don't want to spend 150, 200 bucks, whatever it is. That's fine. But we could also chat in 3 months and see where you're at. Could we have spent a couple $100 and already be there by now? Likely.
Kind of like going back to that weightlifting or the having a coach do, like with Clayton. This was a long time ago. I got stuck with my weightlifting journey or CrossFit journey, because I was about a year and a half into CrossFit then, and I got stuck with my snatches and clean and jerk. And I went to Clayton, a coach who already know he knew how to program, he knew how to he knew the periodization for it for 6 months straight, and took off, man.
Wow.
I mean, if I did that on my own, it probably would have taken years, because I went from 185 pounds to 245 pounds with my snatch, because he had the knowledge and I went to him. If I did that on my own doing research, that probably would have taken years.
Yeah.
So, yeah.
Yeah. And what I hear a lot clinically is, and this isn't to say all PT's the same. It is not. I've seen the good, bad, and the ugly. I've worked in 16 different orthopedic clinics over 5 states when I was doing travel therapy. It's unfortunate, but there are some really undereducated, underskilled physical therapists who are leading people in the wrong direction. So on that note, PT on ice, find a clinician that's going to look up qualified PTs who have taken ice physio courses and speaking the same language, and they're a lot more progressive in our field. So if you're looking for a PT in your area, you can just search ice, find a clinician. But what I hear from people a lot is, man, I wish I would have came in and seen you sooner. They've been struggling for 2-3 months, shoulder pain, tore their labrum, significant pain, couldn't raise their arm. Man, I wish I would have seen you long time ago, because in a month we're 80% better.
You don't have to answer this, but if you want to, you can. Can you give me an example of a bad PT or clinic? It's like, do they just throw in a default exercise in there, or?
Oh yeah, I've seen a few. Without going against my exit paperwork I had to sign when I left the company, there's an example that comes to mind out of Kingman, Arizona. Let's just say everyone who came in, didn't really matter if it was back pain or shoulder pain, but let's just say back pain, a lot of back pain in that area, chronic pain, underserved population. But anyways, let's say back pain, they come in, every single person got a moist heat pack. They lay on a heat pack for about 10, 15 minutes. About that time, the tech would come over, pull it off. the physical therapy assistant would come over and give them a back massage for about 10, 15 minutes. Just some soft tissue work, stroking the low back. Then they would probably lay on their back, rock their knees side to side, do a couple bridges, hip thrusters, do some clamshells. We've all done some clamshells in the past. Yeah. And that was it, bro. Every session. No progression. Nobody was getting off the table. And I'm looking around like, we don't live on a table. We got to be functional. We got to lift groceries. We got to get upstairs. We got to squat, deadlift, lunge, etc. So that's an example. And that's happening all over. Unfortunately, it's profit driven, right? It's way easier to have 10 tables over there and 10 people going at once, just doing some stretches, some massage. It's a little harder to have one-on-one care, get a squat rack, get people loaded up. Another example, I saw someone this morning. They came to me from a different physical therapist because that physical therapist said they didn't do any hands-on care. They were all exercise. It blows my mind. We should be doing it all. We should be doing manual therapy. We should be educating. We should be doing some form of exercise. It's 3 pillars to that chair.
3 pillars. Can you talk about that?
Yeah. I bring a lot of this back from the teaching and learning through ICE Physio. But there are 3 pillars for solid and quality physical therapy is going to be that patient education, skilled manual therapy, and some form of exercise. We got to have all 3. Now, it doesn't mean we need to do cupping or dry needling every session, but we should be affecting tissue or affecting the nervous system somehow. Easy way to do that, adjustment or manipulation, whatever you want to call it. It's the same thing. So we're cracking backs, we're dry needling, we're cupping, we're loading tissue, we're educating them on what this is, how long it's going to take, what they can do at home, what lifestyle habits they should be considering changing. So yeah, all 3 pillars.
Yeah, for your first example, I'm thinking the moist heat pack and stuff like that and the massage.
Yeah.
I'm thinking it's because it gives people that immediate relief, right?
For sure.
And then when they get that immediate relief, they go out. It's like, oh, this place is awesome. Put 5 stars on there and everyone goes.
100%.
And then, but they don't get stronger. The underlying condition doesn't go away. So they keep going back.
Yep.
So I'm guessing that's what was happening.
Yeah. And different schools of thought. It's a pretty good business model, right? You can see someone forever. There's many tools in our bags. There's many things I can do to make you feel better. And now having my own cash practice, some people come to me just to feel better, and that's fine. We'll do soft tissue for an hour if we have to. We'll do dry needling and adjustments or whatever it is. But I tell people, I make sure I educate them. We can do this each week you come in and you can feel better, or we can do this for a period of time until you're feeling better. We open a window of opportunity to load your tissues. Then we move into more loading the tissue for adaptation, for strength, getting you moving more. That's the long-term ticket. So I tell them, we can do this feel-good stuff, but you need the strength, the mobility, stability, etc. on board to actually fix the issue and be sustainable long-term. Mm-hmm. If you don't want to do that, I'll see you, but I'm going to keep putting it in your ear. You know what I mean? Mm-hmm. We're going to talk about your diet. We're going to talk about your sleep. We're going to talk about your alcohol intake because all that's relevant.
Mm-hmm. Yeah, because this was a long time ago. I saw a video of some guys. They were saying if you go to a chiropractor and they tell you just to keep coming out without telling you to exercise, actually fix what's going on, fire that chiropractor or something like that.
I would agree.
Yeah.
I would agree. In my opinion, it's malpractice.
Interesting. You would even put it in that category, huh?
I would go that far to say it's borderline malpractice to do something, assuming they know better, right? There's a lot of good chiropractors out there. There's some poor chiropractors, just like PT, just like coach, anything else. But the good ones are educating their patients on what this is, how long it should take. You can come back for an adjustment, manipulation, whatever to feel good, but you got to be doing XYZ outside the clinic.
Mm-hmm. Yeah. The one that I went to, it was actually a really good one. Unfortunately, I don't remember the place as well, but like I went for a chiro, and there was an FMT, functional movement therapist, and she's like, you need to go to this person as well. Yeah. And I was like, I think you're just money grabbing. Like, no, you really need to like do some functional movement therapy as well, not just getting cracked here. Yeah. So they did that, and then that's why I kept going back, and that helped a lot as well. So, Yeah.
Yeah, the problem I have is if we're just getting cracked and not doing anything else, what are we doing? Are we just looking for the endorphin release? Because we know we get that. Are we just looking for the nervous system to get a nice reset of that muscle? We know we get that. But if cracking it's going to fix your problems, why are you coming back for 3 years every week? I have that conversation with people all the time.
Right.
How long you been going? A couple of years. I usually go every week. Well, is it fixing your problem? It doesn't sound like it, right?
Yeah.
And we're just addressing one piece of the puzzle.
Mm.
Soft tissue, nervous system, tendons, ligaments. There's a lot going on. It's not just cracking backs.
So would you say would it be the same with dry needling, cupping, massage?
Yeah,
Yeah.
100%. I see people who just want dry needling. I tell them, I'll do that. But are you doing X, Y, Z? Can you implement this one little thing throughout your day that's going to help this last longer? If not, I'll needle you as much as you want.
Yeah.
You're right. But I'm going to educate you.
Yeah. Nice. All right. How about this last topic that I want to talk about is about, it's all about warming up, you know?
All right.
Yeah. This is,
Speaking of warming up, I'm cold.
you're cold. Almost done. Hang in there. So, from a PT's perspective, right?
Okay.
Can you let us know whether these practices are either useless or effective? I know we're trying to apply this to gym pop, CrossFitters, weightlifters, bodybuilders, et cetera, So you can probably like, explain some of the nuances in whatever sports, whatever come to mind. Ready?
Okay.
Yeah. So we'll start with the first one, foam rolling.
Oh, yeah. Foam rolling. I have a foam roller. I do. It's overused by a long shot. I don't think it's important from a preparation standpoint to be, I see a lot, but to come in before a workout and roll out your whole body. I don't think it's an effective use of time. If you think it feels good and you think it helps you, I'm always going to say go for it. But if you want to be effective and efficient with your use of time, I use foam rolling mostly for thoracic spine. So I'm getting on it this way, I'm arching over it, might get a few pops, but I'm mobilizing my thoracic spine for any days that I'm overhead or doing front squats because we need more spinal extension. So I use it to pop my back. I use it for more mobility. So I'll do quadruped, throw the needle with the foam roller. It gives me something to press onto. But if you're just coming in, massaging, rolling on your calves and stuff, it's not going to, I think it's useless, essentially.
Stretching, when we talk about that.
Yeah. Active versus static. Active versus static. Active prior to your movement or your exercise, whatever you're doing. Static after. And you guys do a good job at that. The only thing that I see is people don't always do it.
Right, yeah.
I don't know if we hit on that, but something I've seen commonly from CrossFitters is if I could give them any tips as a whole, listen to the coach, stay for the cool down, stay for that session at the end. It's super important. Like take the warm up and cool down seriously.
Cool down's like serious stuff, right? Because it helps you for the following workout.
Yeah.
Even with swimming, when I was with swimming, I mean, after the race, they'll go back to the warm-up pool and they'll be swimming there for 10, 15, 20 minutes.
Yeah. Because the competition's done, right?
Yeah.
You're still swimming.
Because it preps them for the next one. Like,
yeah.
It's really good. General warm-up.
General warm-up, like just getting the heart rate going?
Yeah.
Great.
Well, just to be specific, I'm going to ask movement-specific warm-up as well, because we do this too, but general warm-up.
I think it's great. I think generally speaking, we should elevate our heart rate to get more blood perfusion to our tissues. Less blood flow, vital organs, more out to our extremities before we're about to load them. So I think general warm-up is good. Getting on the bike, getting the heart rate going is helpful.
If you're a powerlifter, or let's say bodybuilder, this is because a lot of people do bodybuilding, right? If you're going to be benching, do you need to ride that bike?
If you're benching, is it advisable to get your heart rate elevated? I would argue yes. If you're crunched for time, do something. Push-ups, some kind of prep. Horizontal push up, barbell, bench, whatever it is.
Ski erg, rower.
Sure.
Yeah. All right. How about movement specific warm up?
I think it's great. It's a way to prime our nervous system, tell our body what we're about to do under more load. So for example, squat day, we're going to start out with those body weight squats, maybe banded to get some hip external rotation activation. We're going to go barbell and then start loading from there. So I think it's great.
activation drills like clamshells, glute bridges, banded walks.
Yeah. The PT stuff.
Yeah.
Sometimes people call it. Yeah. So I think out of that whole list, there should be priorities. If time's never a factor, dude, hit all 5 of those things. Why not? Foam roll, stretch it, mobilize it, get the heart rate up, movement specific, activation, all that. But I think most people are looking for, what do I need to do to have a good workout, and then don't do any extra. Like I got an hour, let's just get after it. So I think activation comes down to ideally having some kind of assessment. Where are we limited? What are we weak at? What are we tight at? Then you address those. So for someone who can't get a full depth squat because they can't activate external rotation or open their knees wide enough to get down, they should be doing some kind of activation drill. For someone who has, for that, the example of my lifter overhead, has trouble firing his lower trapezius on the right, we're doing some lower trap activation prior to his barbell snatch before he loads it. So for those people with some kind of impairment or deficit, I think it's super helpful. I think for the general population, just get warm, go through movement specific, then load.
Hey, Dr. Wade, thanks for coming.
Hey, absolutely. Thanks for having me.